Okay, so tell us some about your district. We'll put up some facts here as we're talking about it. Give us the nature of your district, of the constituents that you're appealing to.
Well, I think what's very consistent with the folks in our district throughout CD1 is that these are American patriots. These are Americans who want their country brought together. They want a representative who's going to be able to work to bring our country back together. And that's what they have been asking for. That's what they've been pushing for. And that's why I'm happy to be our Republican nominee.
So explain how that plays out in practice. I mean, for example, on the subject of trade, how important is that to you? You're up there on the border with Canada. How important is that to you, and where do you stand right now with respect to our trade policy?
Well, obviously, I'm a free trader. I believe in the free market. I certainly, the voters here in this district certainly support that. And you see that. I've spoken to a number of business owners in our district who are engaging in trade, and they're very excited about the president's deal that has been reached with Mexico and Canada. So we're very excited about that. Obviously, we're free traders. We believe the president is very supportive of free trade. But what we're not interested in is other nations dictating to us what is free trade and what is fair trade. And so it's great to have a president who is leading the charge here to make sure the United States is properly represented and how that impacts our state.
So you've got a deal now, it's signed, at least hasn't been ratified, but signed with respect to Canada as well as Mexico. At the same time, we're really at daggers drawn with China still on the issue of trade. There was a report out of Bloomberg just today about this chip hack, that apparently small chips were implanted in some computers to allow the Chinese to get into some U.S. companies. How does that break down for your voters up in New Hampshire? Because on the one hand, free trade, you'd want it with China. On the other hand, you worry about security. How does that play with your voters?
Well, security is always going to be a concern here in the Granite State, because we want to make sure, again, you have to understand that this is the Granite State, right? This is live free or die, and we very much believe in our independence and our liberty. But we also want to make sure that our country is secure. We also want to make sure that we have leaders who respect that, who respect the open markets, who respect free trade, but also understands that our first priority is to keep our country safe.
I know you have a substantial problem with opioids up there, although I have to say across the country we do pretty much, but I know you do up there in your district as well. How does that read against the issue of health care? Because the Republicans came in and did their best to repeal Obamacare altogether, and that's made a lot of people around the country pretty nervous about their health benefits. How does it play up there in your New Hampshire District 1?
Well, the folks here in the Granite State, particularly in Congressional District 1, we understand that we've been disproportionately impacted by the opiate issue. And so we do things a little bit differently here in the Granite State. We're working with communities and families to address this issue. We realize that this is not an issue that you can arrest your way out of, but it's certainly an issue that we have to hold people accountable. So we have to go back and make sure that we have appropriate prevention programs in place, treatment facilities in place. And, as a former law enforcement officer, I can tell you the police officers are always going to do a good job in enforcing our laws, but they have to be supported at the border and making sure that drugs are not coming into our country, whether they're flown into the country or brought over the border, that we secure our nation to make sure that we're holding people accountable. So we have to remember that 75 to 80% of the people who started with a heroin use started with a prescription opiate. So we have to engage the pharmaceutical companies, ask them to participate in this process by supporting some of the cost.
So better prevention. Everybody has to be for that. What about treatment? You still have a fair number of people, though, that need to be treated. And a lot of that treatment actually falls under Obamacare as a practical matter. If you get elected and you go to Congress, are you going to vote with the president to repeal Obamacare?
I am certainly going to be interested in bringing about a free market health care solution. We have never had a free market health care solution in this country, ever. And the notion that somehow we can depend on government to tell us how to get care, when to receive care, how to buy medication, and what facilities we can use is misguided. The fact of the matter is that we need a healthcare system that offers competition. We don't have that under the ACA. And when you talk about affordable healthcare, what's affordable? I can tell you that the middle-class families in this district who are paying between their premium and their deductibles $25,000 to $30,000 a year, that is not affordable. So at the end of the day, we need access. We need more doctors. We've consolidated nearly 1,700 hospitals over the last 20 years. No one would do that and call it expanding health care and access. So we have to get serious about this. And we have to make sure that we're not engaged in economic protectionism that protects certain members of the healthcare industry. You should be able to shop where you need to buy your healthcare insurance. You should be able to go to the doctor of your choosing and your choice. This is the most intimate thing you'll do in life is your healthcare. And so you should have control over that with your physician. So that's what I'm interested in. I think that's what the president is interested in. This notion that somehow you're trying to take people off healthcare is a silly talking point.
Well, let's talk about the president just for one moment in conclusion here. In your primary race, the issue of integrity and honesty factored large, and you embraced that wholeheartedly. There have been a fair number of people around the president now who have been indicted. Some of them have been convicted. There's a sense that there isn't a lot of integrity around the president. I'm not saying the president, but around the president. If President Trump wanted to come up and campaign for you in your district, would you welcome that? Is that going to help you or hurt you?
I think it's going to help me. And of course, I would welcome the president's appearance here. The president is the president of the United States of America. And at the day, let me just touch very briefly on this issue of integrity. I served our country in the United States Navy, and I served our state and our communities as a law enforcement officer. I very much believe in integrity. And I think integrity starts with the other 535 members of Congress as well. And that's what I'm hoping to do is bring about a sense of integrity. The president has high favorables in the CD1 here. So I would welcome him being here. Absolutely.